Healthcare workers are under tremendous stress each and every day. But it's more than just about the healthcare system. There's a moral obligation to taking care of our healthcare workers. Hi, my name is Ted Meissner. Welcome to Mindfulness Voyage. And today we're going to be talking about that moral obligation. Come on, let's get started. Our guest today is Michael Atkinson. Michael, welcome to the podcast. Good to see you.
Hi, Ted. What a privilege to be talking to you today. Thank you for inviting me. It's great.
I'm so very glad to have you here. And we're going to talk about a couple of different things. But before we get into that, maybe you could just give us a little bit of a background about who you are and what you do.
So my name's Michael Atkinson. I'm a mindfulness teacher and have been involved with mindfulness and meditation probably since the late 90s, but teaching it quite formally over the last 10 years or so. I also have a full-time job as a senior lecturer in medical education at the University of Sunderland in the UK. I help run a master's program for the School of Medicine. And I also teach mindfulness to medical students in an academic sense around the neuroscience, around the practice, and also do some sessions for staff. And over the years, I've done a great deal of meditation guidance and courses within higher education, MBSR courses, drop-in sessions, conferences, away days, so many different things. But yeah, in my personal work, it is retreats, it's courses and regular sessions and things like that. But I'm also a podcaster like yourself, but I'm quite new to it.
Yeah, wonderful. And for those who are listening or watching to this episode, I will have links to Michael's website and a couple of his podcasts. And you can find those on the website, but I have those also as separate links for you as well. So one of the things that brought us together was was recent publications and work that you're doing and research you're doing on mindfulness, on burnout, and things that you are bringing into higher education. So I wonder if you could just talk a little bit about some of the things that you're working on now, and maybe some published work that you've already got out there for people to read through.
Yeah, thank you. So I have published on a range of different topics, mainly around education, pedagogy, medical education, more specifically. But on a broader, if you think about scholarship in the broadest sense, a lot of my work is around mindfulness and well-being. And yeah, the most recent work that I'm doing is related to physician care, healthcare workers, well-being. And I think one of the things that stimulated this podcast was my recent publication in the Journal of the American Medical Association on physician care as a moral obligation for systems and institutions and organizations. And I think this was particularly interesting to me because I put it forward as a viewpoint article based on an article I was writing about self-care. And I realized that it was important to think in a balanced way about both systems and individuals because the self-care argument has been going around for quite a long time. And every time I bring that up in mindfulness context is what about the system? It's okay, people being resilient and everything, but what about the system within which they work? And so I wanted to balance those things. And yes, self-care is vitally important, and mindfulness and other practices and approaches can help with that, of course. And that is a responsibility of the individual to do that. But asking systems or pointing the finger towards systems and institutions, I think has been a more difficult argument to take hold. Maybe some resistance within those systems themselves, or maybe just not the capacity to be able to fulfill that. And it occurred to me that it was important to use, if you like, the principles that underpin the healthcare system to form an argument about the importance of physician care. And so I looked to the pillars of medical ethics, beneficence, maleficence, non-maleficence, justice and fidelity. particularly non-maleficence. The idea of to do, the tenet of do no harm. And so I was using something that was quite established already within the literature in medical education and healthcare to give me a foundation or give me a hook to have some influence or persuasion within my argument. And so I put forward the idea, and the idea was always just a stimulus for further discussion. It wasn't this is how it should be or this is how it is. That's not how I approach things. Um, it was really to say physician or lack of physician care. And I use the term physician, yeah, because that's the American kind of, if you like, term for healthcare workers or doctors. And the idea really was that lack of physician care is an issue of non-maleficence. If systems are to expect physicians to operate within a challenging infrastructure, then there's risk of harm to patients. When physician care isn't accounted for, taken care of, then inevitably there are going to be issues around clinical error, burnout, um, lack of, if you like, relational support. And I'm extending that argument a little bit in my current article that I'm about to submit, and that is to say that actually the pillars of medical ethics are, if you like, um, weakened by the fact that physician care isn't underpinning them, and that the foundation of medical ethics should perhaps be physician care. And that article, for some reason, just seems to have hit the paradigm very, very well through JAMA. JAMA being a very, very influential journal. And it has had a lot of views, and I've had various people contacting me. There was a commentary on it in a German journal, healthcare journal. And yeah, and it's leading me more and more towards what I've been working on over the last, if you like, year or two, looking at systems of healthcare and the design of healthcare systems, particularly from a mindfulness and Eastern philosophical perspective, if you like, where holistic and integrated approaches are actually really important.
Yeah, there's so many interesting layers to what you're talking about, Michael, on this. It's interesting, the reflection on this idea of do no harm, of beneficence, and that has always been perhaps inadvertently focused outwards towards patients without also allowing it to be something that is pointed inwards, that is also for healthcare workers, physicians, nurses, whatever role that happens to be, is that that's not something that is applied to people who are having extraordinary levels of burnout, leaving the profession, suicidality. We're seeing these kinds of outcomes because exactly those same kinds of conditions that are focused towards patients have not been focused towards healthcare workers. You mentioned getting some attention from this article, and I'm curious if there's anything you can share about if there have been themes that in people writing to you about this. What are some of the things that people have been sharing with you about their response to the article? Is it synchronous with what their experience has been? Do they have some new points to add? What has that been like?
It's early days, but I mean, I've had a few people talking to me that in really, yeah, resonating with their own experience, really. And I mean, I think nothing new to add necessarily. I think some of the discussions have been around how they'd never quite considered that this could be a medical ethics argument, that ethics goes beyond the individual. Or ethics can go or medical ethics can go beyond the individual to include systems, because medical ethics is traditionally been focused on the behaviors and consequences of those behaviors for individuals, medical students, trainees, and doctors, physicians. And for some reason, not just for one person said that for some reason you've just put the pieces of the jigsaw together in a particular way that has kind of really hit home this issue and why it's important. Because these debates have been going on for decades. They're not new, are they? And I think no matter how much we criticize systems, there's not necessarily going to be change from that critique. There needs to be something that um, that really they strongly relate to, and the profession rests upon, which are the pillars of medical ethics in many ways. And that original oath that doctors do, to do no harm, that is in a way, I think, quite a powerful way of putting the argument back to them, um, and maybe making them think differently about it, because suddenly I'm not overdoing or over-egging the article and its influence, that there is accountability across the board. And um, the emphasis can't keep being on the individual physician. There is too much evidence for burnout. It is such a huge issue. And there may be a lot of physicians, doctors who watch this podcast who would say that, the places within which they work, yes, it's there, it's evident, but it's not an enormous issue. But in some places, it obviously is. I don't know about you, but I don't know if you look into the different contexts internationally and compare those in terms of burnout. But I think, at least the UK, there is still quite a high prevalence. It depends on which profession you're in within healthcare, but there is the variation between 30, 40, and 50 and 60% in terms of levels of burnout, which is really, really high. In the States, I think those stats may be a little bit higher, but internationally, I'm not sure. But I would imagine that some fairly similar stats going on around the world.
They are, and what's interesting is that even within the different specialties for physicians, if we just look at physicians for a moment, different levels based on what kind of work it is that they're doing. So maybe less so in family practice, maybe more so for surgeons or emergency care physicians, for example. And this ties into, I wonder if we could segue just a bit into the systems that you mentioned, because one of the things that you're highlighting is this idea of the self-care, that focus around the accountability for the healthcare worker to take care of themselves. There's an ethics issue with that. And how this works with burnout is that often within other environments, not just healthcare, but in other environments, burnout is seen as needing to be resolved by the individual. That it's seen as a weakness, something the individual needs to do. They need to do more self-care. Here are some techniques that they can address their burnout, rather than the conditions that have caused it in the first place that are not based on that person and the things that they're doing, but the system they're in. And as an example, physicians may have very much an adherence to their ethical commitment to do no harm, for example, and have a strong foundation in the ethics of having an environment that is supportive to healing, well-being, and overall care. But they find themselves in a system where they are not calling the shots of what kinds of decisions affect the ability to do that care. Maybe limitations based on other considerations. The one that comes to mind most often is financial. That there are healthcare institutions that put profits over people. I'm wondering if this is something that you have seen or noticed, or perhaps others have spoken about as like, yeah, I want to do things in an ethical fashion as a physician, as a healthcare worker, whatever that may be, but I can't because the system is set up by which I still have to process this many patients in this amount of time, and I have to take my personal time to do my electronic health records, for
Mm.
example. What are you seeing? Are you getting some feedback on that?
I've had a few conversations, particularly with um, people from the States who comment on how much of a business model that is compared to the UK. Obviously, we have the National Health Service, but generally in a lot of um, professions like education, like healthcare, the business model and managerialism has become very much part of the whole system. Um, and within that bureaucracy, you lose sight of the humanness at the center of it all because you're working with a cold, hard system that doesn't necessarily recognize that humanity. Um, I'm not sure. I mean, I think I've got to be cautious, or I think we have to be cautious to some extent to blame systems or blame it on people who work in those systems because I think maybe a lot of people are there for the right reasons and trying their best, but sometimes the system will dominate no matter, it's a bit like politics, whoever comes into power, they still work within a system that creates conditions for poverty, etc. Um, I think the problem, and I don't know if you want me to extend on that point just generally, and this relates to another project I'm looking at about kind of system design, is that the problem of the system is multifaceted to the point that actually to solve this, I think it's probably easier to design systems from the ground up than it is to change well-established systems that are, for example, in the UK, built in a Victorian infrastructure where the physicality of healthcare provision is fragmented and the people who work in healthcare at different levels are, not particularly well integrated, like, policymakers, healthcare managers, leaders, and medical students, and even the different cultures of nursing and paramedics and medics. There's a certain level of disconnection across all of these different aspects. And one of the projects I'm working on, or the ideas I'm working on, is about designing from the ground up and what would that look like. And I'm actually presenting on this at Durham University in a couple of weeks' time. This idea, it's the first time I wanted to make it public, but just as a kind of taster idea about this, really, is that when you look at healthcare systems or systems from an Eastern philosophical perspective, where holism and spirituality is actually very much part of that philosophy, and interconnectedness, you see that a system um, needs to be deeply integrated and interconnected, um, so that you create a culture that supports everybody. And at the moment, we have fragmented cultures, never mind infrastructure. And um, and I take this no, I take this partly from looking at Japanese culture and how healthcare is seen as a personal responsibility. Healthcare is seen as something that um, is important societally because you have an influence on society if you have ill health. So you have a personal responsibility. And I get that, but also they have an understanding of culture, healthcare culture, and it manifests in the likes of um, people who are at pension age doing Tai Chi at 6 a.m. in the park. And there's a big social and integrated aspect of that, and healthcare being all around you in a way. So it feels natural to um, look after yourself and look after each other. That's much harder in a culture where you have a lot more, if you like, individualism, um, in a rationalized system that is based on perhaps more on the hard sciences than the humanities. Does that make sense? I mean, I hope
Oh, yeah, absolutely.
yeah.
You you are singing from the same sheet music I've got on this, which is the understanding of the cultural context,
Mhm.
as well as the unique needs of a particular cohort, if you're doing a program, for example, is indispensable. And this is, and I think traditionally has been an afterthought
Mhm.
within many healthcare systems in the West. You said it beautifully. I was hoping that you would use that word, is that Western cultures tend to be more individualistic.
Mhm.
That is not a baked in part of our culture to have that sort of folks of a certain age, I'm reaching that age myself, of doing Tai Chi in the park with others, and that this is, there is an interconnectedness to this,
Mhm.
which we tend not to have in our Western settings, particularly around healthcare. And one of the things I wanted to ask about is, as you do teach within higher education,
Mhm.
many of these concepts that we're talking about, how might that influence what you teach in the coming years for those who are entering into healthcare systems? What are some gaps you may be noticing about what people are learning? The here's the what, but is there a noticeable gap on the and here's how we might meet those needs and fill those gaps?
Great question. Thank you for that question. Um, so one of my roles is to lecture on mindfulness, and I've done that for postgraduates and undergraduates over the years, and on particularly on mindfulness, and part of that is practice based, but also the teachings behind it and some of the neuroscience and everything. Um, and what's interesting, the trajectory of mindfulness is that it's becoming more and more mainstream. It's becoming more and more accepted. 10 years ago, maybe 15 years ago, people wouldn't have taken any notice of it. But now, um, I think it is definitely taken more seriously. But I endeavor whenever I teach it to make sure that that seriousness comes across in a light-hearted kind of interactive way, but that actually people don't see it as this superficial, tokenistic type thing that comes up on a screensaver whilst you're at work, that you need to take a break, go walk around the building for 20 minutes, go and get some fresh air, that it's much deeper than that and much more integral and important. And I'll get to your answer about the future, but yeah, one of the things I kind of often communicate or bring up in discussions around this with when we're talking about undergraduate education in particular is that there has been, if you like, a huge gap in their education that mindfulness, I think, is filling. And that is not only the well-beingness and the self-care and the compassion, cultivation of compassion training, which in itself is extensive, uh, but the variety of applications that mindfulness or contemplative practices can bring to almost any aspect of healthcare. And particularly those human connections, that ability to communicate mindfully, to um, be able to relate and to build rapport with patients and colleagues, to take those pauses, to be able to think more clearly when you're making decisions, um, and taking the appropriate rest whenever you need it. Those things are almost assumed within medical education. It's not that long ago that clinical reasoning was treated in the same way. It was in my previous role at Newcastle University where it became defined. And then it got on the curriculum because it had been defined. And that was quite an interesting thing in itself, that actually it was assumed that people would develop their clinical reasoning over time through pattern recognition, through experience, etc., illness, script development, all that kind of thing, which is probably the case in many respects. Um, but it was never taught explicitly in all contexts. I can't talk for other contexts. And I think it's the same pretty much with mindfulness, is that it's assumed that people will develop their compassion, their rapport building skills, their decision making skills, their ability to care for themselves and self-regulate, etc. But as we know from as mindfulness practitioners that and teachers, that takes a lot of personal work, maybe over many, many years, to develop some of those capacities in a balanced and healthy way. It can't be something that's squeezed into medical education. But I do think that we're at the very early stages of what mindfulness and contemplative practices can offer medical education from undergrad through to training at all levels and leadership development. Um, as I mentioned in my article, um, I think it's important that leadership is given a lot of attention around mindfulness or self-care, because if leaders are looking after themselves, then they're role models for students coming through the profession. They're role models for colleagues, and they have a very powerful influence on how things turn out. But if they're not like that, then it makes it much more difficult for everybody else, I think, to think that they have permission to care for themselves. And then you have a much more conflicting set of relationships in the hierarchies in healthcare because people are seeking that deeper, you could call it spiritual, but um, just a more not a more easy time, because I mean everybody wants a more easy time, of course, at work, but I think people are willing to put the hours in and do good quality work if they also have good family life and they also have a real sense of well-being and rest and we know from a lot of the work in neuroscience that rest is incredibly important um, for decision making, for just about everything. And I'm not just talking about sleep, I'm talking about time out. Um, And I know in my experience, it makes me a lot more productive to ensure that I look after myself and the quality of work becomes higher. The other thing I'd just like to touch on very briefly is, and I do bring this up again and again, sometimes in discussions around healthcare, is that if physicians, doctors, healthcare workers aren't looking after themselves particularly well, can they be real advocates for the health of others? Now, that might sound a little bit controversial. I'm hearing, how dare you say that about me? And I work shifts and I have to eat at 2 o'clock in the morning. I can't look after myself. And I understand all of that. I've worked shifts myself. Um, but is somebody really, really going to be good at social prescribing, for example, if they don't have their own um, passion for that? Or they don't do it themselves. It's like being a mindfulness teacher without the training, you live the training so that you can help and serve others. You embody the practice. And I think there's a principle there, I think maybe could be applied to healthcare workers, that actually it's really maybe a responsibility that you really look after yourself and understand what it means to look after yourself in a really good way.
Yeah, and at the very least, modeling the behavior we'd like to see. Right? Think about
Yeah,
having a dietitian who is stuffing down burger after burger while telling you need to eat your vegetables. It's the
yeah,
same kind of thing. If you're not doing this yourself, at first that kind of destabilizes my confidence in what your recommendations are, because it's clearly not being done by someone who should be the expert in this
yeah,
and really knowing it very well.
yeah,
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 and you also bring up the idea of having challenging work, having the reward of that it is fulfilling work, that it is something that is deeply meaningful to you. And this also comes up in burnout research about fitness. And I don't mean your physical and mental fitness. I mean your puzzle piece fitness for the work and alignment of your values with the work that it is you're doing. And
Mm,
if it's just constant overwhelm of work and work and work without being able to see that you are making a difference,
mhm,
can be very isolating. And countering that sense of isolation, that sense of ineffectiveness, that sense of overwhelm,
mhm.
these are three main things to counter the effects of burnout. And these are
Mm.
things that we can take on, especially within healthcare, would be I would think, a very fertile ground that would be more receptive to this. So,
Absolutely.
I,
Yeah.
Michael, one of the things I wanted to ask now is just to open it up a bit for you about what would you like to share with those who are tuned into this conversation about the need for mindfulness, for this awareness around systems thinking and self-care and all these effects. What are some things that we haven't mentioned yet that you really want to plant in people's hearts and minds?
Wow, that's a really big question. Let me think. So I'll just be spontaneous with this and see what comes out when I start talking, because that's sometimes just what happens. I mean, I think we need philosophically a much more balanced underpinning of how we see healthcare. Um, and unless you've had some philosophical training, my first degree was in philosophy, so I often refer to it, but um, one of the critiques of modern healthcare is that it's based on a dualism, mind-body split. So that's part of the reason that mental health has taken a long time to get some attention, is because it's the physical body that has been seen as the thing that is that holds the ill health and gets all of the attention, and I mean, there's much more sophistication to that argument, and it's a bit crude to say that as a generalization. But if you look to Eastern philosophy, and I would argue that there's still potentially a view of Orientalism towards the East. In that, what I say in that is that actually that it because historically it's so far in the past, they didn't people in those days didn't really know as much as we do now, all that kind of stuff. Um, I think an integration, and I think this is integrated health, obviously the field of integrated health is taking the best of all of these different philosophical views and approaches, and making sure that the foundations of the healthcare system are sound as the best can be. That's just philosophical foundations, the foundations of physician care. So the carers are always in an optimum, or as best as can be, an optimum state, and which is also a sustainable state. So you can continue to do your work over a longer period of time rather than thinking you need to retire early to get out of the system, which does happen, particularly when people are feeling burnout. You have high attrition, don't you? So I think the blame needs to come out of it, but I think people need to think more about the whole foundation and try and tackle that. And I carry with me this perpetual gardening metaphor that you just keep tilling the soil, enriching the soil, and things will grow. If you try and force the plants to grow and, you know, use artificial fertilizer, which you could say is, analogy for medication, you are going to be damaging the soil. You are going to be damaging the plants. They're not going to flourish. And I think we need to create the conditions for flourishing, and that is for everybody. And I think the other thing to say, and one of the things I think, and I was going to write an article on this, but I wasn't quite sure how controversial it would be. But if we were to just think for a moment about the whole view of patient-centered care, it all sounds fabulous, and everybody wants patient-centered care. But when you have some people would say it's a mantra of patient-centered care, everybody else gets neglected because it's all about the patient. And it should be all about the patient. But if you switch to, let's for as a thought experiment, physician-centered care, you'd be thinking more about the conditions for good patient care. And I think if you put the efforts into physician care, you might find that patient care is just a natural consequence of that. But it's physician care and patient care that need to come together in a balanced way because you cannot have one without the other. Um, and yeah, that's what I would say as my kind of summary of all I've said there. Don't know if that helps and makes sense.
It does, because what you're describing is an ecosystem. You
Yes.
can't just focus on there's this one particular form of life and we're going to ignore everything else. Like,
Mhm.
it doesn't work that way. It's more complicated, and that's actually one of the things that makes it interesting. Is
Mm,
because we do have more opportunity, and it's completely understandable why there would be an interest on your part in, well, what is it like to build it from the ground up
mhm,
instead of having all these evolutionary dead ends that aren't working so well within healthcare. And instead, what if we started fresh and built this with this idea of an active, dynamic, supportive ecosystem?
mhm.
That would be really interesting work to do, and I'm glad that you're doing it. Thank you
Mhm.
so much for that. For
Yeah,
those who are tuned in, you can find out more in the description. I do have links to the website, a couple of podcasts, and articles. Please do check that out. Our guest today, Michael Atkinson. Michael, thank you so much for being here.
thank you so much. It's been an honor. Thank you. It's been great to talk to you.
Thank you for listening, everyone, to today's episode. And thank you to Michael Atkinson for your time and your insights about taking care of our healthcare workers. And remember, everyone, every moment you have a choice. Make it the best you can. I'll see you again soon on Mindfulness Voyage.